Hello, everyone. Welcome to the medical reporting discussion here at the MVJ 2021 convention presented by the American Medical Association. I think it's safe to say that everyone watching, everyone here, and really all over the world has been somehow, some way touched by the global pandemic in the last year. And if there's one thing that we've learned that I hope we knew already, but that has been reaffirmed, is the growing importance of accurate medical reporting. I've spent nearly the last 2 years, a lot of that time on the front lines, on the front reporting lines of the pandemic for CBS News, from the epicenter, the original epicenter of New York City, traveling hotspots all over the country as they pop up, and accurate information. I don't think this is hyperbole. Accurate information that people are basing their decisions on can be the difference between life and death. Now, I'm joined today by Dr. Gerald Harmon, president of the American Medical Association, who's also a family doctor in the coastal South Carolina area and a retired Air Force Major General. Dr. Harmon, thanks for joining us today.
Thank you very much for having me with you today.
You know, you've got a lengthy and a distinguished career in medicine, as well as in service to our country. For those people who don't know, tell us a little more about your military experience and how that prepared you for becoming a physician.
My dad was similar. We grew up in small town America. My dad was able to get what I would call an ROTC opportunity when he was an undergraduate, wound up being a Korean War veteran, got sick with a fatal illness when I was a youngster. But that was my only military experience. And it was a positive one, but I didn't know my dad that well because he became ill when I was like 11 years old. So the military was kind of far off to me, didn't think about it. But as I went into college and looked at an opportunity, the military offered me a scholarship to go to medical school. I said, this is great. I'll become a doctor if the military needs me, and it's an opportunity to serve. I had no idea at the time that I would have a 35-year military career and have what you would call distinguished, what I think is lengthy, and just because I served so long, I had a lot of experiences. And I'm going to tell you, all my veterans, your veterans that might be viewing this today, it teaches you a lot about life, about your occupation, whatever your career is. It's just an interesting platform that will serve you well no matter what you wind up doing in life. I went to the military and medical school. I had an active duty career after that, and then a long 25-year career in the Air National Guard following my active duty career. I wound up being the Surgeon General for the National Guard, what's called the Chief Surgeon, and I wound up being the Deputy Surgeon General for the United States Air Force. My last duty assignment was then in the Washington, D.C. area, the Pentagon, and at the National Guard Bureau. I just enjoyed the heck out of it, and I really did. What the military taught me was how to take care of people and still have mission focus, and I think the military does all of that for us as veterans. But it also allowed me to compartmentalize what I might have been doing. Compartmentalization is so critical, not only in the military, but in healthcare. You take care of sick people, you do the things that you've experienced over the last 2 years on the COVID front lines, dealing with life and death situations, emotionally disabling and stressful situations. You compartmentalize that as a caregiver, as a journalist, or as a military member. Just a lot of great learning and experience that carries over into the healthcare field.
Veterans' needs are a very unique set of needs. Now, I imagine your experience as a retired Major General combined with your experience as a physician has given you a unique understanding of the needs of veterans. What insight can you give us?
Our veteran workforce, the folks in the military, are trained to do a job. They have an incredible sense of duty. If they don't show up, bad things happen. So they're very service oriented. They're incredibly well trained to show up. They tend to overcome minor mishaps that, and some without that sense of duty may take a sick day, may take a day off, may say, hey, I don't feel exactly right, I'm not going to go to work. In the military, some of our folks didn't have that option. They carry a lot of that over in their civilian lives and in the post-military areas. And then, of course, our veterans serve in a very intense, emotionally demanding area, even if they're not in a combat zone. They may be the only one protecting a base. They may be the only one providing a critical mission support. Even if it's just feeding or providing support for the deployed force or the active defensive force. Everybody in the military has a critically important job. So their sense of duty and their sense of frailty kind of, it works at odds sometimes. They might be afraid to seek care. They might be afraid to, or not so much afraid, but hesitant to say, hey, Doc, I've got a headache or I've got a fever. They wanted to show up, and then after their duty performance, they may come to the doctor. And that kind of sense for veterans carries over into the civilian field, in my opinion. And they still think they're duty bound, and they don't have sometimes the structure after they get discharged from active duty that they might have in the military. We had sick call, we had various command performances and assignments that sometimes doesn't translate well to the veteran post-discharge world.
How would you characterize where we are right now with regards to the pandemic?
In my local area, and indeed in the nation, we've had three distinct waves of the pandemic. We had one that closed us down in the summer of 2020. And I remember March the 13th as my critical start date, my 911 for the COVID pandemic here in coastal South or rural South Carolina and across many of the nation. That's when we closed down many of our hospital facility, elective surgeries. We reduced access to a lot of care. We rescheduled folks. We closed the schools and businesses to some degree. So a lot of things happened on March the 13th. I remember that C day, as it were, COVID day. And then we had a pandemic where we got busy in the summer of 2020, lots of inpatients. Our local hospital system, while not being overwhelmed, was stressed to the limit, up to the very limit, and many healthcare systems across the country. You were in New York City, as you described it, the epicenter. They were stressed. They even deployed extra military hospitals to the New York City area just to help with the overflow, critical overflow there. Had a little reduction after that peak. And then we had another peak in the December, January 2021 timeframe after the holidays, another big peak. That's when we were most burdened here, probably in South Carolina, in my local area. We had
people were gathering for the holidays, getting together, families coming together for Christmas.
Yeah, and now we had a little reprieve, as it were, a little valley where we didn't have quite the episodes of transmission. Then we just had another one here in the summer of 2021, when it stressed us again. So we're now on a little bit of the downslope, thank goodness, but we're not out of the pandemic. I mean, that's your point, and that's my point I'd like to make.
Concerns moving into the winter flu season, people, again, Thanksgiving, Christmas, gathering once again, the Delta variant. How concerned are you about all of those different elements?
Well, the Delta variant taught us a new lesson about how transmissible this virus could be. What we're seeing now is the virus, as it mutated with the Delta variant, became several times more potent and transmissible, had a shorter transmission time. It spiked a huge wave of outbreaks that we're just now starting to recover a little bit from. As we enter into flu season, we're going to go more indoors. Cold weather is going to put us more indoors. It's going to give us into the holiday season where we can gather in. We need to be cognizant and take precautions so that we don't have another outbreak, especially on top of ordinarily would be an influenza season as well.
One of the ways that we manage the virus is through vaccines, but veterans have been a bit reluctant to get vaccinated. Why do you think that is?
Well, one of the things we have to use is our weapon system against this virus, against this pandemic, and it is going to be here. I don't think it's a one and done virus. It's already proven that we're 20 months into the SARS-CoV-2 outbreak, called the COVID-19 outbreak. It's going to be with us. It's going to continue to mutate. We're going to have to develop not only what we would call natural immunity, but vaccine-induced immunity. Vaccines are the best way to manage this. If you get vaccinated, even if you have a breakthrough infection with the illness, you're 10 times more likely to not get sick, and another magnitude of 10 not winding up in the hospital or dying. So vaccines protect you from getting seriously ill. They protect you from getting hospitalized. They protect you from being killed by the virus. Veterans are a little hesitant, perhaps, or at least the data indicates that some of our veteran community is a little more resistant to being mandated into getting the vaccine. It's not that they're, I don't think it's anything that they're trying to do deliberately. They're not just saying, I'm going to refuse to be vaccinated just to show people. They have serious questions about it. They're okay with that. Remember, our veterans are highly educated, highly trained, and they're taught to question things, not to question authority, but to question what they're about to go into. They do a little exercise of situational awareness. Before you put yourself and your team at risk, you want to make sure you've gotten the data. What I try to do when I speak as a retired Air Force officer, as a career physician with 40 years experience and as president of the AMA, is I answer their questions. I try to encourage them. These are not experimental. They're incredibly safe. This is some of the best technology I've ever seen in my career. And those are the veterans that are in the audience. And right now, we'll remember that in the Gulf War, we had a concern about chemical warfare and biological warfare. And we had at the time in the 1990s, early 1990s at the Gulf War, we had anthrax as a concern. We had chemical nerve agents as a concern. We didn't know what we might encounter. So at that time, I received the anthrax vaccine. It was a 5-dose shot. It was that anthrax vaccine. It wasn't available to civilians. It was just available to the deploying active duty folks. And there was some hesitancy there, but really not as much as you might have thought, because we were worried about getting killed. We were told how bad anthrax was. We also had what I would tell you was some injection kits, and we would pre-treat with things called pyridostigmine in case we were getting chemical nerve agents into the deployed area. So all of those were mandated. We had some hesitancy then. It was probably a little more experimental then than it is now. When we're talking about the COVID vaccine, this isn't anything like what we did in the Gulf War. This is serious stuff that you can get as a civilian, not just as a deployed military member. So I would really try to overcome that vaccine hesitancy that you might relate to what happened in the Gulf War 30 years ago to the current situation. This is an unknown enemy. This is a known enemy. This is a COVID virus that attacks you. It attacks your blood vessels, your respiratory system. It causes long-term damage and substantial risk of death and disability. This is a very, very safe, non-experimental. This is an authorized, full-up FDA-approved vaccine that's available. So I tend to try to overcome that hesitancy.
I imagine hearing it from you, hearing it from their physician is helpful. I mean, physicians are among the most trusted people in people's lives.
The best way to overcome organizational resistance and help overcome questions is to continually demonstrate overwhelming competence and excellence. That's what you as a journalist to do, and your valued contributions, and hopefully your veteran journalists are going to do the same. You're going to be consistently accurate and dependable in your data management. And people trust me as a long-term doctor. They'll trust me to decide, should I get my heart surgery done? Should I have my gallbladder repaired? Do I need this hip replacement? They trust me with those decisions. They bring their most trusted family members, their children, their grandparents, their parents, their elderly, invalid families to me for advice. I'm hoping that they'll also take my advice when I tell them, you got to get vaccinated.
As we said at the top, the stakes are high. The information can be a matter of life and death when people are making those decisions, which is why it's critical for journalists to be accurate, to put the story in the proper context, to maintain that public trust. As we know, you're a physician, I'm a journalist. What role do we play in increasing that public confidence in the vaccine?
Well, I'm going to tell you, and you've got a veteran audience. People count on us. They counted on us when we were defending America, when we were on active duty, when we were defending the world values, when we were placed in hostile environments. They counted on us. They depended on us. So we were what I would call fire and forget missiles. Once you put that veteran, that person on duty, and you put them in their post or their duty assignment, you knew it was going to be taken care of. You had every confidence they were going to take you at your command seriously, and they were going to cover your 6 o'clock so that you weren't embarrassed or had an adverse attack from your flank. I'll tell you the same thing. The journalists have to do the same thing. We trust journalists. We trust accurate, scientifically determined journalism to be the hallmark of really what I think a free society. That's why we talk about journalism as the fourth estate. It's a calling to be a journalist, to be an accurate, reliable journalist. You really can change the way humanity responds. Healthcare, military, all of us bear that same amount of responsibility. So I take my job seriously, no matter what job I had in the military. It was working as a young officer, just taking care of sick call, to moving into commanding a hospital, to moving in to commanding the surgeon's office at the Air Force or at the National Guard Bureau. I took all of that very seriously and made it my number one job of the day. Journalists do the same thing. Integrity, accuracy in reporting. We have a huge burden of public responsibility, and I think all of us take that seriously.
Yeah, your job is always hard, but I can say as a journalist, it's been increasingly difficult in the last few years, especially to do what we do, because a question we constantly hear more and more is, what is truth? And if you're like me, that is an unsettling question. The reality is there's so much misinformation out in the public square that it can be difficult to filter out what's true and what's fake. So what role do physicians, what role do journalists play in combating misinformation in particular about vaccines and science that we're seeing so much of today?
You're exactly right. And one of the things I would tell you is that the doctors, physicians, as scientists, and we're all scientists. You don't get through medical school, you don't get into medical school without a scientific background. You don't get through it, and you don't get trained for 3 to 10 years after that in what's called residency and fellowship, graduate medical education training, without having a hefty dose of science, of learning how to learn, to understand how to critically analyze data and reports, then make a decision about it, and then make a recommendation to establish that data and turn it into a treatment plan, an action plan, as we talk about. So the scientist in most physicians has led us to give you a statistic that shows 96% of doctors have taken the vaccine and completed the vaccination process. 96%. So if 96% of those scientists think it's a safe vaccine, that tells all of us something to start with. So that's a real critical data point. The other thing is the noise that you describe. You as a journalist, you're trying to do your homework. You're trying to say, which scientist, is Dr. Harmon accurate, or is Dr. X, Y, or Z, who also has some credentials behind him or her, which one of these folks has given me honest scientific data and not just an off-the-wall opinion, kind of an anecdote. And one of the things we have to be careful for is that we don't practice medicine. We don't make authoritative decisions based on anecdotes. You've got to look at the data. You've got to trust us to review it. And that's something that a real competent journalist is going to do the same thing. Who's an anecdotal professor and who's giving me honest, research-based scientific opinion fact?
Yeah, as far as the reporting goes, obviously every news story relies on different sources of information. Some are based on eyewitness accounts, some are personal experiences, some based on data and expertise. And much of what we've learned here in the last nearly 2 years of reporting on COVID has come from the experts and the data. I'm not a doctor, I'm not a scientist, I'm not an infectious disease specialist. So I come to people like you and ask you for the expertise. But I think this is maybe where it can get kind of tricky. The science and our understanding of the virus is constantly evolving here, right? So how important is it, do you think, to make that part of the story, part of the message, so that people don't lose faith and tune out and say, well, last week they said this and now they're saying this?
You nailed it. Your words mean things, and you talk about science. This is science. Science is a process in evolution. Science is not mathematics. Science sometimes is applied mathematics. Mathematics is more finite. Mathematics is 3 + 4 is 7. 4 × 7 is 28. That's not going to change. Those are hard numbers. But science can change. What's the level? People are asking me all the time, what should I get my antibody level checked to see if I have resistance to the COVID-19 virus? Well, we don't know what antibody level actually provides real resistance. That's the reason we talk about vaccinations, even in the face of an active infection. There's this thing called natural immunity. We presume you might be immune to subsequent infections, but we don't know what triggered your antigen system to produce enough antibody response. Does it really have enough longevity after a natural infection with COVID versus a vaccinated antibody response? We know the vaccinated antibody response is a measured dose, and we know how to measure that, and we have better data. So science is still a process in evolution with large numbers of data captured. Remember, in March of 2020, we didn't know a whole lot of things about treatments, about monoclonal antibodies. So we were all over about anecdotes then. Since then, we've got a lot of scientific study and data under our belts, and we have recommendations. So I not only know that I think the vaccines are, I sincerely believe the vaccine gives me good protection, I have data showing it gives me better protection than non-vaccinated folks. That's the science.
Yeah, I think it can be easy to forget that March of 2020 was not that long ago, that we've come a long way in terms of our understanding of this thing in just 1.5 years.
But I would tell you, not only do we have vaccines to talk about, Mola, we have treatments that I can give you. And a lot of people say, well, if you've got treatments, why should I bother to get vaccinated? Because these treatments do work, but they don't work as well as the vaccine does. When I have inpatients in my local facility, I'm still actively practicing. I'm not just reading about this in the newspaper, Mola. I'm in there instant. I'm instant on the battlefield. I'm actually day to day on the doggone COVID battlefield, and that's not a fun place to be right now, because I'm taking care of people, sometimes young people now. They're more unvaccinated populations tend to be a younger population. They're getting sick. They were previously pretty healthy people, and they felt their youth and their physical preparedness would keep them from getting COVID. Nah. It doesn't. And now I've tried the treatments, and I have a lot of treatments in my arsenal. I'll say a lot. I've got monoclonal antibodies. I've got antiviral intravenous things. I've got high flow oxygen and steroids, that all evidence-based improvements that can delay death and prevent death, but they don't cure it as well as just having the vaccine so that you don't get sick at all to start with.
We've seen both the beginning of vaccine mandates and the backlash with some state governors and other politicians suggesting that vaccinations should only occur on a voluntary basis, that they shouldn't be mandated. Do you think that journalists should give time and space and consideration to viewpoints that oppose the mandates?
Well, journalists have to make their own decisions. I'm not a journalist ethicist, and so I don't have a journalism code of ethics. I know what the AMA has established, and I've gone on record. I support mandates for healthcare professionals to start with. That's one of the highest mandates we put in place. So if you are going to your medic, if you're going to your healthcare professional, you're going to your dentist or your doctor seeking care, you expect that healthcare professional to take all reasonable precautions to not make you sicker when you walk in his or her door than when you leave. So that's one of the things we've put forth in support of the AMA, that doctors, healthcare professionals, they should be required to be vaccinated unless there was a medical contraindication or some reason they can't be vaccinated. But as soon as they're eligible, they need to get. And again, like I said, 96% of doctors, before we even had mandates, stuck their arms up and say, hey, give me the shot. I want that done. So that's one thing. As far as broad mandates for other areas, other businesses, we have the evidence that suggests that vaccination works. And when we can't convince enough people to take this public health emergency seriously, some of the authorities have suggested mandates may be required. And we put them in the same situation with things like seatbelt mandates. There was probably a lot of pushback when people first started having to wear seatbelts. Oh, I'm not sure I'm going to wear that seatbelt. I don't like being told what to do. And what if I get trapped in a burning vehicle? Well, the trouble is seatbelts will protect you substantially. They'll protect public, they'll protect your family members, they'll protect the resources having to be applied if you have mishaps when you don't wear a seatbelt. So it became a public health situation, and no one really gives us much pushback on seatbelts now. They seem to work incredibly well, and it's like airbags. We now have them in all vehicles. That was a mandate too, that you might think, well, I don't want to have to drive a vehicle where if I bump something, the airbag will puff in my face. It saves lives. These vaccines save lives. It's a public health issue, and it doesn't cause the likelihood of risk from the vaccine is incredibly low. We've given 5.5 billion doses across the country, across the world, and 350 million in the United States. Very safe vaccines.
I will add, as far as journalists giving time and space and consideration to viewpoints that oppose mandates, when it comes to storytelling and reporting, not every voice needs to be heard, but all relevant voices need to be heard. And whether you like it or not, governors, politicians are making decisions that affect people. And so their voices and their viewpoints should be represented, whether, again, you like them or not. What journalists, I think, the approach you have to take is that you speak to as many relevant voices, you give people that information, and you hope that they listen to the doctors, listen to the experts in that story, and make the best decision for themselves and for their families and their communities with the information that you've provided them.
That's your strong point. You're a career experienced journalist, Emmy Award-winning journalist. I would listen to you too if I were a journalist, an aspiring journalist for sure. But that's one of the things that we do in America. All of our military veterans, and you as a journalist too, have to give some viewpoint fairness. You have to look at this stuff, and you have to then, the data that they present, it needs to be data, not just anecdotes, to your point. We have an obligation to have our leaders have access to journalists because they're elected leaders there. And I try not to second guess them. I try to educate them and give them enough data so that I can convince them to understand what I believe to be the science.
Dr. Harmon, how has the AMA supported veterans over the years?
Well, number one, we're very supportive of the veterans healthcare system. We think it's critical to do that. Some years back, we offered and support for, and the VA does now, community care program, so that veterans, if they have difficulty accessing certain specialties, certain critical needs, the VA does allow them to go into what we call the civilian community outside of the standard VA medical system and get care. So we really believe that to be critical. Anytime we get a chance to advocate for veterans at the professional level, at the administrative and regulatory level, we do that as well. it's clearly veterans medical care is important to us at AMA. Also, what's important to note is the veterans healthcare system is one of the major sources of training for future physicians, residents, and fellows after medical school graduation. Many academic medical centers are very closely aligned with veterans healthcare centers because the training, the teaching, the expertise from battlefield medicine, from the experience of the veterans healthcare system, is critical to learning how to be a good doctor and how to take care of large volumes of patients.
The AMA recently stated that the VA's federal supremacy project jeopardizes care that veterans receive. As you know, the Supremacy Project would develop national standards of practice for physicians and other healthcare professionals. Can you elaborate some on the AMA's concerns here?
I think, and the AMA thinks, and these other organizations think, that these folks need to be trained and accountable and regulated and licensed by their various state medical boards and licensing organizations, not by the VA as an organization independent of those. So we're real concerned about that. We don't think there's anything nefarious in the VA doing that, but in their rush to do something, they didn't allow us to have input. We think they would do better if they want to try to expand access to healthcare for veterans, to work with the organizations, to work with the various licensing boards, to work with the various medical organizations like the AMA to help us come to what we expect for our veterans: quality, accountable healthcare for our veterans. That opens up the opportunity that they may not be getting as valuable or as adequately trained quality specialists as we'd like to have. It puts them at risk, and we're not happy with that. We want to make sure our veterans get health care. I'm a veteran. My son's a veteran. My family is covered by the VA healthcare system. So I'm speaking not only as a provider, but as a recipient.
What is the best model for care for veterans, in your opinion?
Veterans come back after being deployed, after being in the long-term in the military. They come to the civilian world. There's not a lot of behavioral health, not a lot of mental health access, but it's not only for veterans, it's for everybody. But veterans are particularly prone to it because they're not really prone to talking about whatever stresses, their battlefield fatigue and things like that. So we need to improve healthcare for our veterans. There's a lot of efforts in many state and national levels to improve access to behavioral and mental health for veterans. The other healthcare system I allude to is the community healthcare system. So when the VA has a need, or veterans have a particular medical need outside of the local VA system, they can exercise the option to get healthcare on what I would call the civilian market, as long as it's accountable to the VA and conversely, transparently, that the VA healthcare is accountable to the state and regulatory licensing system. That's the best model. Qualified, accountable healthcare for all. That's the best model we want to see for our veterans.
Are the right moves being made? Is the momentum going in the right direction here? Where do we stand?
Well, we're getting better. Number one, we recognize it's a crisis. Right now, to your point, the COVID pandemic is in front of it. And we've seen that. But before we had a COVID pandemic, we had a behavioral issue. We had a behavioral health issue. We had the opioid use crisis. It was already killing 70, 80,000 folks a year from opioid overdoses. So we've recognized that. We've taken steps to address that. Recognition is part of the solution. We don't want to lose that type of epidemic in the midst of the COVID pandemic as well. We've also found healthcare disparities. We've had health equity issues we knew that existed in society before we had the COVID pandemic, but the COVID pandemic has shown us that folks in minoritized communities are twice as likely to die as other folks when they're affected with COVID illness. So all of these shortfalls in our public health infrastructure have been manifest and really highlighted in the COVID pandemic world. Veterans are not immune to that.
Well, Dr. Harmon, that's about all we have time for, but I do want to thank you for giving a voice, joining us today, giving a voice to veterans, to the medical community, and sharing your expertise, with all that's going on today. It is greatly appreciated. And to everyone out there who's, all the veterans who are thinking about, who are pursuing careers in journalism, you've already proven you're public service oriented, and this industry needs public service minded people. This is very much, the Fourth Estate is very much a public service, and for it to be successful and serve the public interest, it has to be populated by people who pursue it that way. So I want to thank you for joining us today, Dr. Harmon.
Well, it's an honor to be with you, an honor to be among this talented veteran audience. And To echo exactly what you're saying, this is another true service where you can touch many, many lives. If you become a qualified, trusted journalist, you can touch many, many lives, and the pen will be mightier than the sword at some point. No question of it.